3 people have died after a suspected hantavirus outbreak on a cruise ship in the South Atlantic. The infections happened on the MV Hantavirus polar expedition vessel. It was traveling from Argentina to Cape Verde in Africa. There's still about 150 passengers on board, and officials say at least 3 others are sick. Anna Cunningham following this. Anna, 3 dead, 3 sick, and presumably a lot of worried people still on board. There's also now a message from the World Health Organization.
Yeah, that's right, David. This is all highly unusual. The World Health Organization saying the risk to the wider public remains low and that there is no need for panic or travel restrictions. Now, as you said, 3 people have died. This cruise, we know, left southern Argentina about 3 weeks ago with 150 people on board. It was heading to Cape Verde, but the ship is actually a Netherlands-based ship, and the tour company Oceanwide Expeditions say they are now dealing with a quote-unquote serious medical situation on board. Let's just show you more of that statement we've had from the World Health Organization. It says this: 1 case of hantavirus infection has been laboratory confirmed, and there are 5 additional suspected cases. Of the 6 affected individuals, 3 have died and 1 is currently in intensive care in South Africa. David, the South African Health Ministry has given us a few more details, saying that 69 and 70-year-old Dutch couple, they were the ones who died, and the 3rd person is a German national.
And Anna, how, when we talk about hantavirus itself, this is a virus that we see pop up from time to time in Canada. It has been fatal in this country as well. How dangerous might it be on board this cruise ship?
Well, look, I mean, it's found worldwide, you're quite right, but it actually only started being monitored in the early 90s. In Canada, we know deer mice are just some of the rodents who carry it. You were talking earlier, David, to Dr. Gupta in terms of just how dangerous this is. Let's just get a reminder of what he said.
There's a version of this in the Americas that causes something slightly different called a cardiopulmonary syndrome, where the capillaries in the lungs get leaky, fluid accumulates in the lungs, the heart stops working well, and that can be very rapidly fatal as well. So either way, it's a virus that can be very dangerous. Depending on the outbreak, the case fatality rate has been described as high as 80%. Often cited numbers in the 25 to 30% range. That percentage of people can die from this virus.
Look, David, I think the situation as it is right now is that they do not know where this originated. Was it on board the ship, or was it incubated by a passenger who picked it up elsewhere?
And most of those on the ship are still on the ship. Some are sick. Others may have been exposed. What happens now?
Well, the ship's operator want to evacuate those who need urgent medical attention, but the issue that they have is the authorities in Cape Verde are not allowing the ship into port. So we're hearing that medics are working on an evacuation plan for those most ill, and also we're hearing that the ship is now reconsidering rerouting possibly to Gran Canaria or Tenerife. Those are the Canary Islands just off West Africa. And if that is what happens, then those other passengers, it hopes, can finally disembark.
Anna Cunningham, thank you.